All right. Well, good afternoon, everybody, and welcome to Healthy Hearts. My name is Calissa Hall, and I am an exercise physiologist here at HSS. In today's webinar, we are going to talk about promoting heart health. Our guests today are nurse practitioner Sophia Kuchuk, registered dietitian Rebecca Tonneson, and exercise physiologist Chelsea Long. Glad to have you here, and thanks for joining us today. We do have a chat room and we encourage you to ask questions. If you have any concerns or need any clarification, feel free to ask them in the chat room and they'll be in the Q&A and they'll be monitored by our staff. I will get them and then I can pose them to the guests on the panel to get them answered for you. A big thank you to Sophia, Rebecca, and Chelsea for attending this webinar. How is everybody doing today? Everybody okay?
Good. Yeah.
Now, Sophia, you work in the main hospital, is that correct?
I do.
Okay. And Rebecca, are you also in the main hospital?
Yep.
Yes, good. And Chelsea, you work in two different locations, correct?
I do. I'm at Sports East and at the West Side campus.
Great. Okay, great. All right. So to start us off, we need to define heart disease. Sophia, I'll start with you. What is heart disease and what causes it?
So the term heart disease can refer to a lot of things, but I think what most people think about is coronary artery disease, meaning the arteries of your heart start getting deposit on its walls, which can cause you to have chest pain and eventually lead to a heart attack. Causes of heart disease can be high blood pressure, high cholesterol, smoking, and those are actually are the three number one risk factors that can lead you to have heart disease.
Okay, well, that was my next question was what are the risk factors for developing heart disease? Great. So you said the artery walls and smoking, obesity, anything else you want to add to the risk factors or which ones are preventable?
So the preventable ones are obesity or being overweight, having an unhealthy diet, having physical inactivity, definitely smoking, and obstructive sleep apnea. All those things you can work with a nutritionist, an exercise program, and any of those things to help you reduce those specific risk factors.
Okay. Great. Okay. So considering those risk factors that you already mentioned, what are some other medical conditions that can contribute to the risk of developing heart disease?
So diabetes,
Mm-hmm.
renal disease. So if you have any sort of kidney disease,
Mm-hmm.
there are also certain autoimmune diseases that can contribute to having arteries or vessels in your body that are just not working properly.
Oh, okay. Interesting. So then how is heart disease diagnosed? I mean, do you have to go to
Um,
a cardiologist or is it something that they can see any general physician or how is it diagnosed?
yeah, I mean, you can definitely start with your primary care doctor. They can run some blood tests, some, things that you are probably already getting done, like checking your cholesterol levels, your triglycerides, checking to see if you have diabetes by checking your hemoglobin A1C. They can do a chest x-ray to look at the size of your heart. They can do an EKG. All those tests can be done by a primary care doctor. And then if they see an abnormality, they can always send you to a cardiologist.
Oh, okay, great. So then what does the blood pressure have to do with the heart disease?
So the blood pressure can cause damage to the vessels in your body. It makes your heart work extra hard to push the blood out of your heart to the rest of the body.
Mhm.
And the higher the blood pressure, the harder the heart will have to work, eventually causing it to fail and not work as well. And
Okay.
then if it causes damage to the vessels around your kidneys, it can cause kidney problems. If it causes damage to the vessels around your eyes, it can cause vision problems. It can basically cause problems throughout, and you won't even notice that it's happening, unfortunately, because we don't feel that we have high blood pressure.
I see. And normal blood pressure is what, 120 over 80, correct?
120/80. Yep.
Okay. So how often should someone be monitoring their blood pressure? Is it something they should do every day, or is that overkill unless there's something going on?
So if you're somebody who has a high blood pressure problem and you're on medications, they recommend that you check it twice a day, same time in the morning and the evening. If you
Mhm.
don't have a problem that you know of, when you go to the doctor is often enough.
Right. So do you recommend just getting one of those home units and just checking it on one of those? Are those pretty reliable?
They are. I actually love, there's ones that can go on your wrist. They're
Uh,
very small, really easy to use. Um, and, they just work off of regular batteries.
Awesome. Great. Technology. All right. Well, thank you, Sophia, for all your helpful answers. Understanding the heart disease and its causes makes it easier to understand how to prevent it. Since one of the most common risk factors for heart disease, as you said, is obesity caused by poor nutrition, it only makes sense that we discuss the key parts of a healthy diet, heart healthy diet, which brings me to you, Rebecca, our nutrition expert on the panel today. Thank you. So tell me, what does a heart healthy diet look like?
So I'm going to give a boring dietitian answer. It's just a well-balanced diet with enough whole grains, fruits, vegetables, and healthy fats. Healthy fats is the key part of it, though. We've all heard saturated fat is what is linked to heart disease. So you want to really make sure that your saturated fat intake is lower. So they recommend less than 10% of your daily calorie intake should be saturated fat. What's important though is when you decrease your saturated fat intake, you replace it with healthy fats instead of refined carbohydrates. You don't want to replace it just with breads and pastas and stuff like that. You want to make sure that you go for those unsaturated fats. So your olive oils, your avocado, your nuts, your seeds, all of that good stuff. Seafood is really good for you. So making sure you decrease your saturated fat, increase unsaturated, and then of course, limit your salt intake. The recommendation is less than a teaspoon of sodium a day.
Wow.
So making sure, less processed foods, more whole foods, that's going to be really important.
Okay. So is there anything other specific that you think we should keep in moderation? I know you mentioned a couple of things, but anything else stand out?
So the red meats in moderation and the salt in moderation, processed foods, the cakes, the candies, the sweets, definitely sugars in general, you're going to want to keep in moderation. Yeah.
Great. Great. So then what does cholesterol have to do with heart disease?
So cholesterol, increased cholesterol can increase your risk of heart disease. It can cause the nasty stuff in your arteries. What's important though is that your blood cholesterol is very different from your dietary cholesterol. So you can get cholesterol from your diet, from things like eggs and animal products, but that's different than your blood cholesterol.
Okay. So we have good cholesterol, bad cholesterol, and dietary cholesterol.
Good cholesterol, bad cholesterol is just your blood cholesterol. HDL is your good. You want it, I think it's above 60 because that decreases your risk. It's the cholesterol that takes the stuff out of your arteries. The LDL is what deposits the stuff into your arteries. So that's why they call LDL bad and you want it lower. Dietary cholesterol is just cholesterol in food. It doesn't, I think it's been demonized a lot. There's no direct link between dietary cholesterol and your blood cholesterol. What's most important is your saturated fat intake. But if you think about it, a lot of things that have high cholesterol, like eggs, you're probably eating with saturated fat, like bacon or something like that. So you just want to make a few adjustments there, but people can eat eggs. That's always a big question we get. You can have an egg a day and be okay.
Well, that's good to know. So then what are trans fats?
Trans fats are just processed fats. So it basically takes an unsaturated fat, flips it so that it's saturated and it's solid in room temperature. And the chemical makeup of it just makes it very unhealthy for us. It's something that's banned from most restaurants at this point. You will find it in like vegetable shortenings or again, really processed foods like certain cakes and cookies and things like that. Margarine as well, but at this point, there's not a lot of trans fat in our diet, luckily. But
Okay.
check the label.
Check the label. It's good advice.
Always check the label.
Always check the label. All right. Well, thank you, Rebecca. Thanks for all your responses. Hopefully, we'll all be eating a heart-healthy diet tonight using your helpful advice. As mentioned earlier, another common risk factor for developing heart disease is physical inactivity. That means more sedentary individuals are more at risk for developing heart disease. Chelsea, I will come to you for your expert advice on this. So how often should I be exercising?
So exercising, you're looking at 150 to 300 minutes of moderate to intense cardiovascular exercise per week for the reduction of symptoms for heart disease. So that's 20 to 30 minutes on a bike, 20 to 30 minutes of an intense walk, roughly most days of the week. And you want to, if you're just starting a workout regimen, you want to go every other day to prevent soreness and kind of reducing the desire to exercise, because you want to keep that up and build momentum. So doing it every other day can reduce some of the symptoms that make us not want to exercise.
Well, that makes sense.
Mm-hmm.
And what kinds of physical activity are best to build the heart health?
Well, to build the heart health, you want to have a good blood pressure profile, which is decreased with concurrent cardiovascular exercise. You want to have a good lipid profile, and strength training gives you a better metabolism, and it gives you the lean body mass that's going to use those fats a lot better. So increasing strength training and increasing your cardiovascular exercise, your walking, your elliptical, your treadmill, your bike, your swimming, all of that's going to increase your heart rate and decrease your blood pressure and like your resting heart rate. So your heart doesn't have to work as hard when you're just sitting sedentary.
Right. Yeah, I have a lot of clients that think that strengthening doesn't really target heart health, but it does. You do get a lot of, cardiovascular benefits from strengthening. So
It does.
thanks for mentioning that. Yeah.
Mm-hmm.
So is physical activity cumulative, or do I need exercise for an hour at a time to improve it?
You don't need exercise an hour at a time to improve it. So everybody has a baseline, kind of like where you are throughout the day, what you do on a daily basis. Anything above what you do normally is going to be considered exercise. So if you're basically getting 5,000 steps a day at minimum, and you increase your steps to 7,000 steps a day, those extra 2,000 steps is exercise. You could do that with just counting your steps. Or if you hop on the bike twice a week for 20 minutes and you've never done that before, you're now exercising. So just continually to increase your physical activity throughout the day and monitoring what you're doing so that you can kind of keep track of what's working for you, what's helping, what you like, what you don't like. All of that just improves your metabolic profile, increasing your healthy fats, decreasing your blood sugar and your blood pressure. So it's all good stuff, and anything above normal is exercise. And then you can continue to build on that to create a more well-rounded program.
Right. Yeah, I like to tell my clients to pepper exercise into their
Yeah.
day. So if that means marching in place while waiting for the elevator, or taking the stairs instead of the elevator, or push-ups on the kitchen counter while you're waiting for your coffee to brew, standing up from a chair, standing 10 times before moving on. So it doesn't have to be all at once, and to be effective and helpful and to add up to benefits. Okay, so how should you manage exercise after an orthopedic surgery? Is it okay to put that cardiovascular exercise on hold?
Right. So there's a certain amount of time we're going to give you a little grace period after orthopedic surgery, and it kind of depends on what you just had surgery on, whether you are able to be weight bearing or not. If you had orthopedic surgery on your lower body, there's nothing that says you can't do some upper body exercise. So at a lot of facilities, you have an upper body ergometer. It's a little arm bike. You can do upper body aerobics. You can do strength training with your upper body. You can start speaking to a nutritionist and kind of combo the two together, make that your starting point, right? Take advantage of the downtime to really create that program and that kind of setting where you're going to increase your physical activity and added change. And then get after orthopedic surgery, getting to your physical therapist, making sure you're on a program. And then there's always, again, if you had orthopedic limitations in your lower body, you can see a trainer, you can see an exercise physiologist to work on your upper body as well.
Yeah, so you don't have to put it on hold. You just find different ways to target it, right?
Mhm. Different ways to do everything. You just got to ask questions and
Just ask
try
questions.
something new. Mhm.
I like that. All right, so how do I prevent injury during cardiovascular exercise?
Starting too fast is going to be hard to do. So you want to make sure you stay slow. If you're just starting a cardiovascular program, like I said, you haven't been doing any. So just a little bit is going to make changes. So just start walking, add some more steps to your day. But there's weight bearing exercise and non-weight bearing. So walking, jogging, stairs, treadmill, those are all weight bearing exercises. So if you have orthopedic limitations, make sure you're kind of starting slow, because it could lead to stiffnesses and tightnesses or knee pain. Or you could do non-weight bearing, riding a bike, swimming, ellipticals, kind of both, kind of just doing something that you can kind of maintain for 20 to 30 minutes, starting slow, not going too hard so you're not sore. And then make sure you're cleared with your doctor if you have any sort of cardiovascular limitations or disease diagnosis.
Okay. Well, you mentioned a couple of these, but are there some other examples of low impact cardiovascular exercise?
Well, so swimming, there's a recumbent bike where you sit down and the pedals are in front of you. A regular seated bike, there's spin bikes. The elliptical is kind of a mix of the two. But if you have orthopedic limitations, then the arm bike is also a great one as well.
Okay. Yeah, I love the UBE.
Great.
So all of these questions just make me think back to what was said earlier about blood pressure with Sophia. I have some clients who have been prescribed beta blockers, which are the medications prescribed to reduce blood pressure. And they work by blocking the effects of the hormone epinephrine, also known as adrenaline. Beta blockers cause your heart rate to beat more slowly and with less force, which then lowers your blood pressure. So with regard to exercise, their heart rate doesn't necessarily go up. So we have to be creative and use their perceived exertion as a guide when the exercise is too much. So understanding their own symptoms, the medications, the exertion levels can guide the appropriate exercise prescription as well to make exercising safe for the individual. Okay, well, thank you, Chelsea. These are helpful tips, and also seems manageable for any physical level, which is important, I think. So I just have a couple of additional questions, which I'll just pose to the group. Feel free to answer as you wish. These have been pretty stressful times for all of us, and our stress levels have been probably higher than ever. So can chronic stress affect cardiovascular health? I say yes.
Definitely.
Yeah. Yeah. I feel like it can affect sleep. It can affect the way you eat, it affect your routine. All of that specifically just can throw you off, right? And then that just all adds up to potential harm.
So chronic
I mean,
stress can maintain a high elevated heart rate,
Mhm.
which would increase your blood pressure. And when you have
Yeah.
consistently high blood pressure, your heart's working extra hard, and all of those risk factors for heart disease just start to creep in and creep up. You have hormone changes. Lots of things can happen when you're chronically stressed.
yeah. If you're not sleeping well, then you're tired during the day, which means you might be drinking more coffee, which will contribute to high blood pressure. You might be eating more to stay awake,
Yeah.
which will contribute to weight gain. All those things. Yeah.
Yeah, they all add up, don't they? Okay, so is there any other heart healthy habits that we might want to consider? Anything we didn't touch on that you guys want to throw in there before I open up to the great group we have listening in today?
Personally, I would just say that increasing your daily activity level above what you normally do, making sure you're getting your steps in, making sure you're just making conscious decisions, portion control, like Rebecca said, everything in moderation. You don't want to restrict anything specific. So making sure you're just watching everything, creating a healthier lifestyle one step at a time is really the best way to maintain it. So.
Yeah, okay. Great tips. Okay, so we're going to go ahead and just check the chat room for some additional questions. If you haven't already, please submit any questions in the Q&A, concerns, clarifications, and we will get to them as we can. I have the first question here is early on, Sophia mentioned sleep apnea. What is this and how do I know if I have it?
So one of the easiest ways to know if you have it is if your partner complains about your snoring excessively. But basically what it means is when you lie down flat, the weight of your chest, the weight of your neck presses down on your airway, and you stop breathing for 10, 15, 20, 30, sometimes a whole minute at a time. And then your body wakes you up so that you can take a breath. That can increase your blood pressure, that can put strain on your heart, and it also contributes to very bad sleep night after night after night.
Got
Uh,
it.
yeah.
So if somebody I have a client who wears a heart rate monitor at night, and he has
Mhm.
those times where his heart rate basically just drops off, or it'll just shoot through the roof. Is that what's happening?
Yep. Anytime that you are having an apnea period, meaning you're not breathing, your heart rate will slow down. It could go down as low as, 40 or 50 beats per minute.
Mm.
And as soon as you wake up, it shoots up because it's a stressful event because you were deprived of oxygen. Yeah.
Okay. All right. Okay, good question. So the next question is, it looks like it's for Rebecca. Are there specific foods that reduce cholesterol? And they subnote, I've heard oatmeal is one.
So the reason you heard oatmeal as one is because it's really high in fiber, specifically in soluble fiber. So foods that reduce cholesterol, again, are going to be the healthy fats, which I mentioned, the unsaturated, and foods that are high in fiber. So yes, oatmeal definitely can contribute. Things like avocados, beans, bananas, all of those good things that are high in soluble fiber will also contribute to lowering your cholesterol. It kind of helps clean you out.
Okay, good. Okay, great question. Another one for you, Rebecca. Do you have any recommendations for daily caloric intake from sweets? It's a good one.
That is a good one. Because I love sweets. I love chocolate. But the recommendation from the American Heart Association is going to be less than 10% of your daily calories from added sugars. So that means if your daily calories are 2,000 calories, less than 200 calories from added sugars. So that's like around 50 grams. So, you can have like a dessert, a small portion of a dessert, at night and be fine, but you don't want to be having like a whole pint of ice cream. That would be a lot more than the recommendation.
A little bit.
A little.
Okay. All right. So this is for, I guess, for anyone on the panel. Do at-home over-the-counter cholesterol testing kits work? This person has not seen their doctor due to COVID. Anyone have a?
First, I'm going to say is that not seeing your doctor due to COVID is probably not the best idea. A lot of people have chronic conditions that will worsen over time if they don't follow up with their primary or specialty provider, especially with things like heart disease, like diabetes, like kidney disease. But the at-home cholesterol tests do work, and they could especially be good for creating a baseline. So you can take the test and find out where you are. And if those numbers start creeping up, then you should probably see somebody about that to help you manage your cholesterol levels.
Right. And I feel like with anything, consulting your doctor, registered dietitian, exercise physiologist, nurse practitioner is kind of the first step anyway. And we do have telehealth as an option to touch base, just reaching out. That way the doctor can assess the concerns on a one-on-one basis. Okay, so we have another one here. Is a fast CT scan worth getting? And if so, at what age should you have it? Believe that one would be for Sophia. Do you know anything about the fast CT scan?
I do not know what a fast CT scan is. May need some clarification.
Okay.
You can do a CAT scan angiogram, meaning a CAT scan that looks at your arteries and what they look like.
Mhm.
Um, but again, that is something that you would want to speak to your provider about. Usually a cardiologist, most of the time an interventional cardiologist who can interpret those results and figure out where to go from there.
Okay. Okay, very good questions. And we can also clarify that a little bit further if you'd like. If you want to leave a comment at the end, we can certainly investigate that question for you a little bit further if necessary. Okay, so we have another question. Was there an adjustment to the BP numbers of 120/80? I know I haven't heard any adjustments to that as being the norm. Have you?
No, in fact, they want it below 120 and below 80. They consider blood pressure 120 to 129 to be elevated, and 130 to 139 as hypertensive.
Got it. Oh,
Yeah,
okay. That's an interesting clarification. Yes.
yeah.
Okay. Okay. So that's all these questions. I'll give you guys a couple more minutes to ask some more questions. Oh, well, you got another one coming in. These are great questions, everybody. So what is the difference between a nutritionist and a dietitian? I would like to talk to someone about my diet because I have high cholesterol and they notated it's 260.
Okay, so you can email me. So a dietitian has the RD credential. We have to go to a certain amount of schooling. We have to do a specific training. We have a certain amount of clinical hours that we need to do. And we have this really hard test that we have to pass. And then we are qualified to work in hospitals. We can be covered by insurance, and we can give medical nutrition therapy. Someone who is a nutritionist, anyone can be a nutritionist. That term is not regulated. So anyone can call themselves a nutritionist, but not just anyone can call themselves a registered dietitian. So for something like high cholesterol, where you're going to need medical nutrition therapy, you would definitely want an RD.
Okay.
It can be very confusing.
Yeah. Well, thank you for clarifying that. The difference, because I know a lot of people ask me the same question. Okay, on to the next one. Getting great questions. Is intermittent fasting healthy for cardiovascular health? I'm fasting 15 hours and eating healthy for 8 hours.
Intermittent fasting. So in general, I am not aware of any specific research that links intermittent fasting to cardiovascular health. If it helps you lose weight and follow a healthier diet, then that's great on a personal level. In general, I don't blanket recommend intermittent fasting for just anyone. That's definitely something that's individualized. If you think that that has helped you, again, decrease your weight or decrease your sweets intake, then I'm sure that that's helping your cardiovascular health. But in general, no, I wouldn't say that that's going to be like the best thing for cardiovascular health. I'm not aware of any research that says that.
Okay.
I would say that as long as you're limiting your caloric intake
Right.
to the recommended caloric intake.
Yeah.
And you're eating a good variety of food.
Yeah. So whether you eat it in 8 hours versus 10 hours,
right,
whatever works for you.
Got it. Okay, so can you discuss what saturated fat looks like?
What it looks like?
Question.
Well, what it looks like is a solid fatty chain acid, and it's usually solid at room temperature, and it is usually in animal products. There is also saturated fat in coconut oil and palm oil, but the chemical makeup is slightly different. So it's a little bit better than saturated fat from animal products, but not as good as unsaturated fat. So what it looks like is it's solid in room temperature, mostly from animal products, but also from coconuts.
So Rebecca,
that answers. Sorry?
I said, so would you say the marbling in your steak is saturated fat?
Right. So the marbling in your steak would be saturated fat. A stick of butter is a stick of saturated fat. That's what it looks like. So I hope that answers your question.
Good question. Okay, next one. I'm 85 and don't do any strength training. Where should I start? And will it still impact my heart health at this age? Chelsea, you want to?
Yes, and yes.
Yes, and yes.
Right. So there's never a wrong time to start strength training. There's a wrong way to start, and there's never the wrong time to start impacting your cardiovascular health. So you can start by contacting your local hospital, and working with an exercise physiologist would be my primary goal. But you could start by just increasing your movement. If you're walking around without aid, just increase your steps. If you need help walking around, hiring an exercise physiologist, or just starting on a seated chair program, just increasing, do some bicep curls, some rows. All of that strength training is not only going to help your cardiovascular health, but it's also going to increase your posture. It can still help with bone density, just all the way up. Increasing your muscle mass is going to help you feel more strong. It's going to help increase your metabolic profile. So you're not that you're going to put on lean body mass, but it's still going to help motivate and change and do some nice stuff for your cardiovascular health.
Right. Yeah. You mentioned, wait, what did you just talk about? We're talking.
It's like a seated strengthening program.
Yes, a body weight
Do
exercise.
it in your chair. Body awareness.
So body weight exercises, sometimes that's all you need because it's good for bone health. Okay, right.
Getting up and down out of your chair a couple more times an hour than you do normally. All of that is going to increase your caloric expenditure throughout the day, which will decrease your cardiovascular risk.
Awesome. Okay, and so another one about exercise. Is isometric exercise good for heart, or does exercise have to be cardio to be beneficial?
Exercise does not have to be cardiovascular to be beneficial, but exercise is cardiovascular in nature. So anything above your normal resting heart rate that you normally do throughout the day is going to increase that heart rate, and that's a cardiovascular response. Isometric exercises are not great for your heart. When you hold on to that intrathoracic pressure, you're going to have your heart rate kind of slows down a bit. The pressure kind of creates an uncomfortability kind of in your heart. And if you already have a heart issue, or if you have high cholesterol or high blood pressure, it's going to make those jump and change, and it can cause some bad things for your heart rate response.
Okay, all right. And so this one is about drinking. So does drinking wine, coffee, and diet soda impact your cardiovascular health? That's a good question.
Yes.
Yeah.
So, too much alcohol is not great for your cardiovascular health. I think the recommendation is 1 glass of wine for women and two drinks for men is where you want to stay. I know that people love to say red wine is good for your heart, again, you want to stay within that recommendation. You don't want to drink a whole bottle of red wine just because there's some antioxidants in there. It's not that protective. Diet soda, you want to decrease your amount of any type of soda. And then coffee, I'm going to be honest, the recommendation changes all the time with the risk for cardiovascular disease and just health in general. I would say if coffee makes you really jittery and you feel like it increases your heart rate, then you would want to avoid it. If you drink coffee and you're adding in a lot of sugar or a lot of fat, like a lot of milk, creamer, you would want to decrease that. You don't want to go over 1 to 2 cups a day either. That is excessive, but I think, a cup a day is okay. But again, there's always research about coffee, and even I get confused sometimes, so I get it.
Yeah, there is.
All those alcoholic drinks break down into sugars, and those are not good for us.
Yeah, definitely the alcohol is not good for you. Yes.
Excessive alcohol raises your blood pressure, unfortunately.
Yeah, and it can, increase your risk for liver disease and all of these other things. So,
okay. Okay, so this viewer asked, I am the correct weight, but have a muffin top, middle-aged spread. How can you get rid of it?
So in general, you can't spot reduce anything. We all, unfortunately, I'm sure we all have areas that we would love to specifically work on. So unfortunately, the answer is just general caloric restriction, just trying to lose weight. In general, you can't target your stomach or anything like that. But you're right that kind of fat pattern is associated with an increased risk. If you have more around your belly as opposed to like your hips, that generally is associated with an increased risk for cardiovascular disease.
Right. And with that, that desire to change the body type, you want to look at fat distribution, but also muscle mass number. So you want to look at what your body fat percentage is, what your lean body mass, what your muscle percentage is, not just your overall weight, because someone who's 150 with a little bit of muffin top versus someone who's 150 but is pretty solid, they're going to have a much different metabolic profile. They're the same weight, but they're going to be a little, even if they're the same size, they're going to be the same. They're going to have different blood profile makeup, different blood pressures, different heart rates. And we all know that those internal systems are what increases our risk or decreases the risk for cardiovascular disease. So taking a look at how to change your profile makeup. So whether you need to decrease fat or increase lean body mass, increasing your strength training while increasing some cardiovascular activity is all going to help just reduce the body fat percentage overall, your whole body, not just, again, it's not going to spot reduce, but decreasing total body fat percentage is definitely going to be your number one helpful tip for decreasing risk for cardiovascular disease.
Great. Great tips. Okay, can you clarify the difference health-wise between butter and margarine?
Butter is just from a cow. It's just there is saturated fat, but it's a whole food. Margarine is a processed butter-like substance that tastes really good, but again, a lot of times there are some trans fats in there. More recently, though, there have been products that are dairy-free, so it's not butter, but they also don't have trans fats. So I think off the top of my head, like Earth Balance is a dairy-free butter that kind of is like margarine, but does not have trans fats. I know that's really confusing. Read your labels if you are trying to get margarine. Always look for 0 trans fats, but there's nothing wrong with having butter. You just want to limit the amount of it.
Okay. The questions keep coming in, ladies. Okay, we've got another one. This one is, I walk a lot, 4 to 5 miles a day. I sometimes get bouts of plantar fasciitis. I do exercise to calm it down and cut down my mileage temporarily. Is there anyone on the HSS team that I could make an appointment with to review my gait, shoes, and stretching routine?
Yes. So myself and Calissa are both exercise physiologists. You can give us a call. Our number is online, or I'm sure you can get it from the webinar. Call the Performance Center. We do gait analysis. We do lots of stretching and foam rolling. We have a specific process called MELT that some of us can teach you. It's just literally foam rolling for your feet to kind of help people forget about their feet unless there's a problem, but to help loosen up the tightnesses, the stiffnesses, make sure you're utilizing your toes the proper way. We have a lot of stuff that we can go over to help out with plantar fasciitis and just continuing to be a little bit more loose and without compensations moving forward.
Yeah, because everything starts with the feet, right? If something goes on in your gait pattern, then it can affect the knees and then the hip, low back, and everything. It's just
About bunions, even calluses, blisters, they can all change how you walk. And if you're sensitive on the left side and less sensitive on the right, you can have some imbalances, and then your hips are shifting wrong and it just shoots up the chain. So getting some real work done on your feet, making sure they're good to go, we can do that.
Awesome. Okay, another one. How can you get to balanced diet with the intake of Warfarin medication? That cannot eat leafy green vegetables. I find this very difficult in choosing vegetables to cook. Does anybody have any information on that?
So
okay, go ahead.
do you want to, so in general, you want a consistent vitamin K intake. I don't know what your, specific intake is, so I can't comment on that. But looking up vegetables that are lower in that, I don't want to give any specific numbers or anything, because again, I think this is a little beyond the scope of just general cardiovascular health. So I would definitely reach out to whoever is managing your medication. I'm sure that they have contacts with either an NP who can provide you that information or a dietitian. Balancing that with warfarin is definitely difficult.
So
Go ahead.
the interesting thing is that there are things that are very, very high.
Right.
And then there are things that are sort of reasonably high.
Right.
So green leafy vegetables like kale, like spinach, collard greens, they are very high. And so most people managing your Coumadin will ask you to stay away from those. But things like broccoli, like Brussels sprouts, green beans, those are lower. Those are reasonably lower or a lot lower. And those would be okay. And most of your providers will say, don't eat the things that are super high and keep the same amount of the things that are somewhat high.
Right.
And then they will work with you. Just talk to them about the difficulties in creating a healthy diet, and they will help you find what works well.
The key is to keep it consistent. You don't want it to be
Yeah.
every single day. And so that's why I don't want to give specific recommendations, because we don't know what you're eating right now. So
Okay, we just got another one. Any suggestions for increasing heart rate during the workday in an office working condition?
Well, an office working condition is tough. You don't want to get on the floor and do any workouts or make yourself sweaty because you have a whole day of work to do. But if you're on calls all day, you have at least 1 minute between one call and the next where you can do 10 squats, 10 push-ups, move around, high knees, couple jumping jacks, something that's just going to give it a little spike and then calm you back down. If you have a lunch break, if you have an hour for lunch, you don't need an hour to eat, but you could spend 30 minutes doing some low impact aerobic exercises, squat with a reach, work on your balance, some single leg RDLs, a couple of standing ab sets. There's a lot of things that you can do that aren't gonna make you sweat, but are gonna increase your heart rate and just give you a little bit more of that caloric expenditure throughout the day.
Right. And stretching exercises for the neck and the shoulders. Because
Yeah, rolling the
all are
shoulders,
these days.
stretching the neck, all of it. Wrists. People forget how bad the wrist can get when you're typing on a computer all day. So,
Okay, we've got another nutrition question. What % of calories should be from fat? Are non-fat foods always healthier, i.e., non-fat versus full-fat yogurt?
okay, so general recommendation for fat intake is about 20 to 35% of your daily calorie intake. So it's a pretty big range, but whatever works for your lifestyle and for your needs and your goals. And then the second question was non-fat versus full fat, like products. Yeah, so no fat or low fat is not necessarily healthier. Like I mentioned before, if you decrease your fat intake but replace it with refined carbohydrates or sugars, it's kind of defeating the purpose. So a lot of times what these products will do to make it still taste good without the fat is they add in some sugars. So yeah, not necessarily healthier. Always read the labels to see what they added in there. If you prefer a full fat yogurt, there's nothing wrong with that. It's a pretty healthy fat and it's got really good protein in it. So if that's what you prefer, there's no reason that you have to do the low fat option.
Great.
Referring to labels, if you look at calorie count in a full fat plain yogurt versus no fat flavored yogurt, they're either about the same or the full fat will actually be less.
Yeah.
Yeah, that's a good point.
I read the labels.
Gotta read the labels. Okay, we have 2 more questions. Okay, so again, great questions, everybody. What are your thoughts on postmenopausal women who are overweight and don't exercise in relation to cardiac health?
increase your daily physical activity, right? So just because you're postmenopausal doesn't mean you can't increase your daily activity. And honestly, that doesn't have to mean go get a personal trainer. It doesn't have to mean go get a gym membership. It literally just means increase your daily movement. So if you're sedentary and you don't do very much, take the stairs. If you live on the 17th floor, you can take the elevator to the 15th floor and walk the last 2. There's all sorts of things. You can just break up your day, stand up, do some squats. Just my favorite is the modified jumping jack, where you're not actually jumping, but you're stepping out, lifting your arms. Increasing the amount of muscles you're using is going to increase your heart rate without actually making you jump or skip or go start running program, because that's definitely not what you want to do if you're not doing any cardiovascular exercise.
Great.
And as you might know well, unfortunately, once we go through menopause as women, our risk for heart disease begins to equal men.
Mhm.
And because women don't show symptoms in a classic way, the way men do, we're actually are more likely to die from a heart attack than a man. So any little bit of exercise you can do is better than no exercise at all.
Okay.
And if you're really worried, check with your doctor, have a physical before you start any sort of physical activity routine.
The last question here is, well, I have two more. Does postmenopausal affect your health? I think we might have just covered that, correct? Okay, and then the last one, I have excess vitamin B6. What causes this issue?
I feel like that's pretty rare just from your diet. So I'm not sure what's causing that issue for you specifically. I would have to know a little more. I don't want to, really go into that. That seems a little bit outside of the scope of this webinar right now.
Okay. All right. Well, again, well, we have a couple more questions that they're referring me to. What are the symptoms of a potential heart attack in a woman?
Good question. So it's going to sound incredibly vague, but it can be abdominal pain, nausea. So it can mimic something like an acid reflux attack. Some women will get vague pain in the neck or the shoulders that does not feel like the typical elephant sitting on your chest pain. Sometimes they'll just feel dizzy or lightheaded or exceedingly tired.
Mhm.
That's a good way.
Anything that feels out of the ordinary would be a good idea to talk to a doctor about.
Okay. Good question. Okay, and we do have another one. I am underweight. How do I gain weight and be heart healthy?
Increase your calorie intake. You got to increase those healthy fats. Lots of avocados, lots of olive oil, a lot of nuts and seeds and nut butters. Increase your fiber intake. Other than that, to get more specific, I would definitely reach out to a dietitian so that they can kind of tailor something more specifically to you. But eat, have more calories.
And you can also gain lean body mass,
Right.
which is heart healthy. You don't have to just gain weight in general.
Right.
Gaining lean body mass is going to be heart preventative. So making sure you're starting a strength training routine, increasing your protein intake, all the good stuff that's going to help increase muscle mass, not specifically just increase your body weight.
Okay. Great. Thanks for all your questions, everybody. To sum things up, I just wanted to say, the main takeaways from our conversation today is that heart disease is one of the leading causes of death in men and women in the United States, but there are risk factors that can be preventable, which we learned today. Remember to eat a healthy diet full of healthy foods, such as lean proteins, leafy green vegetables, whole grains, and healthy fats. You want to aim to reduce the risk of heart disease by maintaining a healthy body weight with regular exercise and physical activity, which we got a lot of examples of that today as well. Avoid other risks of heart disease, such as smoking and exercise alcohol consumption. And remember, Team HSS is here to help. As always, consult your doctor or health professional before starting any new program. And with any questions or concerns relating to your own heart health, and seek guidance from a registered dietitian and exercise physiologist to help guide your journey to a healthier heart. I just want to say thank you again to the panel for helping summarize the most important information here regarding heart health. That is all the time we have today. Thank you again for tuning in. And if you have any questions or would like to learn more about HSS, feel free to comment below or visit hss.edu. Thank you, everyone, and have a great day.
Thank you, Calissa.
You're welcome.
Thank you.
Thank you.
Thank you.